All right. Well, I don't want to take up more time than we have to for this. I know we only have an hour scheduled and we have a lot to get through. So I'm going to go ahead and get started and people will join as they can. So first off, welcome everyone. Thank you so much for joining me. My name is Rachel Araujo. I am the new director of certification for SSH. I just started on August 1st. And they already have me doing these presentations. So that's really fun and not at all nerve-wracking for me. So I hope you all get some enjoyment out of this, and please bear with me if my nerves decide to get the better of me. What we're going to be talking about today is the SSH certifications, so CHSE and CHSOS. CHSE has now been around for 10 years. And we've been promoting excellence through the use of the test development lifecycle. So the whole purpose of the call today, our webinar today, will be going through some behind the scenes views of how we develop content for the CHSE and the CHSOS examinations, and to give a little bit of insight and maybe help those who are studying to prepare for the exam. I have time at the end for questions, so I just ask that you keep all of your questions until the end, and we'll go through those. If you have to use the chat function for questions at the end, that's fine too. You don't have to speak up if you do not want to. So starting off, what is certification? So we want our certification exams to confirm the knowledge, skills, and abilities of the minimally competent candidate. So that's set not only by the testing standards, but also our eligibility requirements. So we know for both of these examinations, you have to have 2 years of practice as a simulationist, so working in simulation. So we want to make sure that we keep everything at that 2-year level and confirm the knowledge, skills, and abilities of people at that 2-year level. It is developed as a service to the healthcare simulation community. We want to use it as a way to promote accepted evidence-based practice and promote a standardization of practice. It is also a recognition of individual competency. So it distinguishes between those who are certified, those who are competent to practice, and those who are not. And it's important to note that when we develop content for the exam and we write test questions or test items for the exams, our test questions reflect that distinction. Meaning we want people who know their stuff, who are competent to practice, to get the question right, and people who don't know their stuff to get the question wrong. So we don't want to have anything in there that would trick a competent candidate, for example, and cause them to get the question wrong. So no tricks or anything sneaky in the exams. SSH has some standard assessment design requirements. They apply through all phases of the test development lifecycle. The first one I want to touch on is that SMEs are integrated into every step. And who are SMEs? SMEs are subject matter experts. So people like yourselves who are working as simulationists. All subject matter experts must have achieved the distinction, though, for the program that they are working on. So CHSE and CHSEAs can volunteer to work on CHSEA projects. If you have a CHSOS, you're not working on the CHSE. An effort that we have made is that SMEs are recruited to represent a diverse group of practitioners. So that means we want people from all walks of simulation or healthcare simulation. So it's not just nurses, who are using to write test questions or approve the exams. We want veterinarians that are using simulation, people in the military who are using simulation. So we look from people from different worlds in healthcare simulation. We also look for people who have, people who have different years of experience. So we don't have all of our SMEs be those who have, 20 years of experience. They're great, they have good insight. But if we had an entire group of people with 20 years experience, the exam would probably be more difficult than we need it, because where you are at 20 years versus 2 years is a little a little different to say the least. So also different geographic regions. So we don't just have people from the states, definitely not just people from one state. We try and engage our international subject matter experts as much as we can throughout all of the practices. So again, this diverse group of subject matter experts works on these exams. We also partner with Prometric, who is our testing vendor, to advise on best practices, especially when it comes to the NCCA. So you see that little digital badge down there, that's for NCCA. They are the National Commission for Certifying Agencies. Our programs are accredited through them, and we rely heavily on Prometric to be up to date with all of the guidelines and established best testing practices, and to give that to us and guide us with those in mind. We also use them to provide psychometric analysis of not only examination performance, but item performance as well. And that's a little bit of a teaser. We'll be talking more about that as we move on through the presentation. We also have a certification examination council, and we rely heavily on their involvement and oversight as well throughout the assessment design process. So y'all already kind of saw this for a minute. This is our test development life cycle. So this is all of the steps that happen throughout test development. Of course, the top one being job analysis or practice analysis, and then item writing, item review, examination form construction, form review and approval, and then it goes into administration. So you see there's all of these steps before an exam is even seen by candidates. And then after it's seen by candidates, the work is not yet done. We do validations, standard setting, equating, scaling and score reporting, and then the process begins again. And we're going to talk in depth about all of these steps. So the first step is item writing. Oh, sorry, I just jumped ahead. Practice analysis. So practice analysis takes place for SSH. The standard is every 5 to 7 years, and SSH does every 5 years. So they try and get it done at a more frequent level because there are so many changes in healthcare that occur, and we want to make sure those are captured as often as possible. There are 3 meetings that we do for the practice analysis, and the first 3 meetings are all to develop a list of essential knowledge, skills, and abilities, or KSAs. So with the each meeting happens in a different location. So we have a North America meeting, a Southeast Asia meeting, and then a European meeting. And all of those 3 meetings are with different groups of subject matter experts. And we say, okay, what are the essential knowledge, skills, and abilities to being either a simulation healthcare educator or an operations specialist? And they're 2 separate lists, but we go and we get everyone's list of essential knowledge, skills, and abilities. And the facilitator works on getting those KSAs into measurable objectives. So we use, as you'll see later, Bloom's taxonomy as a way to write those KSAs as measurable objectives. The list of KSAs is then distributed in a survey format for participant input. So everyone who is working as a simulationist in the healthcare setting is asked to take the survey and provide their opinions on each of the KSAs. And we asked for how frequently you perform the task and how important you feel it is to you. So we use those 2 scales. Once the survey closes, the psychometricians will review that data and give it back to another group of subject matter experts for review. And we look at inclusion and exclusion criteria. So if the scale, let's say the importance scale is on a 5-point scale of importance, from 0 being no way, not important, to 5 being absolutely the most important, we would want every KSA to be at least a 3. So everything that the mean or the average response wasn't at least a 3, the psychometricians will show it to the subject matter expert group and say, okay, this one didn't perform well. Do we need to rewrite it? Do we need to remove it? How do we handle it? We also look at comments from the respondents as well. So after each section of the survey, there's an option for respondents to add, oh, is there anything that we left out? Is there anything that we need to touch on? So those are reviewed as well. And if there's anything that we did leave out, we include into the KSA list. And then that KSA list results in the examination blueprint, or we call the content outline. So that is the end result of the practice analysis. Moving on, we now go to item writing. So we have our content outline, which determines what we're going to write questions on, and we recruit a group of subject matter experts who will serve as item writers. Item writers are trained by Prometric staff with a focus on the following. The first one is that content must be linked to the examination blueprint. So I tell them I could see the best item I've ever seen written in my entire life. If it does not link to the content outline, we cannot use it. And the link isn't just content, it's also that level of blooms. And we'll see examples of those coming up. So if the measurable objective in the content outline is written as a kind of knowledge level, it needs to be a knowledge level question. So it determines the content even to that level. The SMEs are also trained on test taking tips or good test taking strategies. So they're told not to do those. So the key isn't always C, or the key isn't the longest one out of everything that makes it really obvious. Some more test taking strategies like cluing, where keywords are repeated in the stem and then one of the options, so it's obviously the right answer. They're told to avoid those at all costs. The next thing they are trained on is super important to me, and that is that all items, all test content, all test questions must be true in both theory and practice. Those two worlds have to meet. And what that means is the professional literature or the reference says the key is correct or the answer is correct, it's the right thing to do. And then what the subject matter expert believes and does in their practice is the right thing to do. So it's not just one person's idea or one person's preference on how to do things. Those worlds of theory and practice have to meet. Another thing we stress with our item writers is that the concept of the content, the item itself, has to be important and worth testing. So I always say to them, you took this exam, you've sat for this exam. If you saw your question on your exam, would you be shaking your head and wanting to flip your desk and go, oh my gosh, why are they asking me this? If yes, you might want to revise it. It should be important, worth testing. We don't test any trivia. We don't test any kind of history or anything like that. The next thing is that items are clear and not vague. It's very important that the candidate has all the information in the stem or the setup of the item to answer the question. They should have to make logical conclusions if it's an application level exam, but we don't want them guessing or stressing out after knowing what's being asked of them. So clear, concise, not vague, very important. And the next is we want to remain free of creating any potential bias. So we do that by always mentioning the position or the title instead of a person. So instead of saying a name, we always say, the simulation educator or the learner. So no names, only titles. We also remain free of mentioning sex, age, religion, all that juicy stuff, unless it's absolutely imperative to the understanding of the item. And then we also don't want any bias towards a specific vendor. So we also don't use any vendor names in the examination. So anything's just going to be, partial task trainer and describe the functionality of the simulator instead of giving it a name or naming a vendor. So again, as I mentioned, our content outline has measurable objectives. All of those start with a verb, and those verbs will tell you the type of test question to expect to see. So our first level is our knowledge level, so our knowledge comprehension. So knowledge, just because it's the most basic, does not mean that it's bad. I don't want anyone to get that idea. Just because it's basic doesn't mean it's bad. It's just the top level. So if you're looking at the content outline or the examination blueprint and you see verbs like identify, recognize, define, describe, those are all knowledge comprehension level verbs. So you get a knowledge comprehensive type question. Obviously, this question is just used as an example. It is nothing that you will see on the test. The example here is which full moon takes place in September. It is a knowledge level question. You know it or you don't. And if anyone is curious, the answer here is the harvest moon. We just had it, I believe, over the weekend, we had the harvest moon. The next level up is our application analysis level. And this is what you'll see the most of, especially on the CHSE. This is our kind of gold star where we want to be. The verbs you'll see in the measurable objectives are apply, demonstrate, differentiate, use, or utilize. The example given here is a makeup artist applying a prosthetic to an actor's chest. The actor begins wheezing and coughing. How should the makeup artist proceed? The key, of course, is to remove the prosthetic and call emergency services. The candidate has to recognize that the wheezing and coughing are signs of an allergic reaction to whatever's being used to apply the prosthetic, probably liquid latex, and they have to call emergency services. If this was a knowledge level question, the question would be, you know, which of the following are signs of an allergic reaction, or which of the following would call for emergency services or something like that. So allergic reaction is not said at all in the STEM or that first portion of the question. The candidate has to make that logical conclusion to find the right answer. When thinking of Bloom's taxonomy and test questions, I like to think of it as like a subway map. I live in Florida, very familiar with subways, right? Makes sense that I would think of it this way. But your knowledge question is 1 point on the map. You are here. And now your application is maybe your blue line, how you get from here to here. The next highest level that we use in the examination item writing is our critical level thinking or an, synthesis evaluation level. So if you see anything on the content outline that uses the verb analyze, create, manage, recommend, those two are big ones. Those are our critical level thinking questions. And before I get too much into it, I do want to point out that this question is relatively short. There are only 3 sentences. So critical level thinking questions don't have to be an entire case study. They don't have to be an entirely page long. What makes it a critical level thinking question is that if one thing changes kind of in our setup, we might have a different key. So our example given here is we have a caterer who's planning a menu for a children's celiac disease fundraiser. This event will take place outdoors in a local park. Which menu option would be the best? So working through our options, Merlot glazed pork medallions, sounds delicious. Appropriate for children? Probably not. I don't know a lot of children who'd be like, yes, mommy, I want Merlot glazed pork medallions today, please. Right? Not gonna happen. So if it wasn't a children's event, option A might be the best. Chicken drumsticks, fried chicken. Kids probably like that, right? Kids like fried chicken a lot, but the breading, probably not gluten-free. Is it good for a celiac disease fundraiser? It's not really nice to have something on the menu that they cannot eat. So if it was a different disease or a different organization for the fundraiser, maybe that would have been a good option. So that's what makes it a critical level thinking question. You kind of work all the way down, compare, and figure out, you know, what's going to be the best for this. You know, tuna salad, not the best for outdoors. I don't like sun-baked tuna. I would assume most people do not as well. So these are the 3 types of questions that we are working with when we are training our item writers. They're trained to follow, again, those verb cues to get to that level of question that we need. And then they are usually given about 4 weeks. They are usually asked to write only 5 questions each. So we don't have, you know, one person writing 50 questions to make up the entire bulk of the examination. So they're given, about 4 weeks to submit their questions. And then we go into item review. It is important to note here, item reviewers are also trained by Prometric staff with a focus on the same rules as item writing, except for it's a little bit more detailed and a little bit more focused. They also have to make sure all of the terminology matches with the terminology that's used in the SSH dictionary to make sure everything is being used consistently throughout and we're not causing any confusion. The reviewers will go through the items and they have to reach a consensus amongst the group to determine the future of the item. So one person, again, is just not making the determination about any test question. Our item writers are not the same as item reviewers in one cycle. So in the same year, if someone is writing items, they're not also reviewing it, so they're not approving their own content. We have separate groups of item writers and item reviewers. For the next year, if someone who wrote wants to review, that's fine. They just can't do the same in the same year. There are 3 possible outcomes for each test question that's written. It is either revised and accepted into the item bank. It is put to a needs modification status that is saying it needs more work, or it's deleted. When items are accepted into the item bank, it is not necessarily going to go right onto an examination. It goes into the bank. And it could either be pulled for using on the actual certification exam, or it could be pulled to use in a version of the practice test. So if it's used for the practice test, it's deleted kind of from the bank after the fact, because we don't want it to show up on a certification exam after. That would be terrible. But it's really important to us that our content for the practice test is the same level of quality as the content for the actual test. So item writers aren't told you're writing for the practice test today. We also don't use kind of like reject items or items that need more work for the practice test, because then you wouldn't really be practicing for the test. The content is different. If the level of quality of the content is different, you're not actually preparing for the exam. So it is, again, very important for us that we have that same level of quality for both of the products. Moving on, after we have all of the items that are reviewed and they're in one of their 3 statuses, the next thing that we do is to construct a form of the exam. So what is an exam form? For both the CHSE program and the CHSOS programs, we use what we call fixed forms. That means that it's the same 115 items for one version of the exam. It doesn't random pull. You don't get a mix of test questions every time. So there's a new form every year. So a new collection of 115 items. Each exam contains 100 active status questions. So those are weighted. Those are the ones that are scored. They determine your pass or fail status. And then 15 pre-test questions. So items that were accepted into the item bank after item review go into the pre-test status. So they don't determine a pass-fail status. They are not weighted. They do not count until they've been on an exam in that pre-test status, and we know how they're performing. We know how candidates are responding to them. When our Prometric friends, our Prometric staff pulls or constructs an examination form, they do it based on 4 factors. So the first one is the test specifications. So those test specifications are, again, set by the examination blueprint that was determined in the practice analysis. So it'll say you have so many questions that we need to ask from domain 1, from domain 2, domain 3. Those stay the same for every single examination form. So again, allowing for that standardization. We have the same number of questions from domain 1 on every version of the examination. They also pull to status specifications. So again, making sure they're only getting items on the exam that are pre-test questions and active questions. No inactive, no needs modification, nothing like that will appear on an actual exam. They also have overlap requirements. So in order to equate or determine the cut score for each form of the exam, we need to make sure we have some carryover from the previous form. So all examination forms have between 30 and 40% overlap between the exam. So 30 to 40% of the items from the previous form will be used on the new one. And there are also psychometric parameters. So we use what we call IRT equating for the CHSE exam. That's item response theory. That is a number scale, and items are put on a scale according to its difficulty. So we look at the average of the previous form and we match that average to the new one to make sure that we have the same level of difficulty between exam forms. So we don't want one candidate who tested in 2021 to get a super easy form, and then a candidate in 2022 to get a super difficult form. That's not fair. We want the same level of difficulty, again, standardization throughout the test development lifecycle, throughout the various forms of the examination. So once the Prometric team has all of that knocked out of the park, they have their subject matter experts our subject matter experts for review and approval. So again, different group of subject matter experts who are now in charge of reviewing for the content for the exam. So they're given access to the entire exam and a worksheet where they can take notes, and they review for content appropriateness. So all items, whether they have been used 20 times or whether they've never been used before, get the same level of review. And the subject matter experts are asked, is this valid? Is it the correct answer identified? Is this still happening in practice? Is it important to test on? They have to kind of check all those boxes for each of the items. They're also taught to look for bad pairs. So bad pairs exist under two circumstances. The first would be if one question kind of teaches the answer to another, we would want to remove that. Or if two questions test the same concept in the exact same way, right? So we wouldn't want two questions about standardized simulated patients, being used to test taking a health history, right? We wouldn't want that question on there twice because then we're not determining competency. We're almost determining, did you remember your answer from your last one? Or so some candidates, did you hedge your bets? Choose one answer for one and one for the other. Any items not meeting the consensus approval by the subject matter expert group are removed from the examination form and are replaced. So the SMEs will choose a replacement item, one that they like, and they go through the entire 115 items until they have a collection of 115 that meets all of the standards and meets their approval. And then that examination form, that collection of 115 items, is what is administered for candidates. And as you know from our test development lifecycle, just because the examination has been administered does not mean that we are done. So the next step for us is all of our post-administration review and scoring. So the first thing that happens is a statistical analysis of all items. Again, it doesn't matter if it's a brand new baby item that's its first time on a form or an item that has been used 6 or 7 times, everything gets reviewed. The two statistical factors we look at are p-val and p-bis. So p-val is the percent of candidates who answer the question correct. So if that's a 0.7, 70% are answering correct. Super easy to determine that one. And the next one we look at is the p-bis, or point by serial. And that is the correlation between item performance and exam performance. That value is on a scale from a -1 to a +1. +1 would indicate that everyone who got the question right passed the test. And that doesn't happen. That is imaginary. I have never seen it in all of my 14 years in assessment design. It doesn't happen. Candidates have a 4-option multiple choice. They have a 25% chance of guessing correct if they don't know it. And even candidates who are competent have knowledge gaps, or they may read something wrong, or they may just have test anxiety and may answer it wrong. So as long as the p-bis is on the positive end of the spectrum, we're happy. Anything on the negative end of the spectrum is automatically flagged for review. So if it's not discriminating, automatically flagged for review. We also look at candidate comments along with the statistics. So on each item on the exam, candidates are given the opportunity to create, ask a comment. So if I get a statistics back on an item, let's say 40% of the candidates are answering correct. It has a low discrimination or low p-bis, and I see candidate comments and they're saying, well, I do both A and B in practice. I'm like, okay, this is a problem. We might have 2 keys here. So the item will be flagged. And then what we do with all those flagged items is we do what we call a PIN call, or problem item notification webinar. And again, whole other group of subject matter experts are on this call, and they're trained on what the statistics mean. And we have the psychometrician from Prometric on the call with them, walking them through why the item was flagged, what's kind of looking funky for us as far as the performance, if there are any candidate comments, and then they decide what to do with the item. So the item may be okay as is, it's just kind of a one-off, maybe people just didn't get it this time around, or, oh yeah, there's a problem, practice has changed with the item, it needs to be inactivated or it needs to be revised. So all of the items that are flagged get sent to subject matter experts for review, and then during a call, they make the determination on what should happen to the items. They also review all of the pretest items. And if the pretest items have solid, good statistics, they're performing the way we want them to perform, they get to grow up. So they get changed now to active or scored status items. They become weighted in the item bank. So they have an opportunity now for the next version of the examination to be used in a scored position. So again, we don't use any items in scored positions that haven't gone through the whole process, and we know that they're performing well, and the candidates are responding to them the way we want them to respond to. We also look at the scored items of, again, if they're problematic, they get deleted or revised. And we also review the scored items for performance drift. So again, for equating, every item is put on a difficulty scale, and that average difficulty determines the cut of the exam. So if something was once performing, at a 70% and now it's a 50%, that's going to affect the cut. And we need to know about it and look at it and determine if it needs to be readjusted on the scale at all for that. So always reviewing these items, always making sure they're in tip-top shape before they're actually being used to evaluate competency for a candidate. And then next, the process begins again. So not necessarily the practice analysis. Again, that only happens every 5 years or so. But we do a gap analysis or a needs analysis of the bank. So we'll look at how many items we have on each domain. If for some reason all of our items in domain 2 performed terribly and we had to delete a bunch of them, then we need to know that so we can focus our item writing efforts there during the next session. So new item writers and reviewers are recruited and trained. Again, this happens on a yearly basis. We also work closely, multiple meetings a year with our folks at Prometric to look at our processes, review our processes, and make sure that nothing needs to be adjusted or changed based on any new best practice in the testing world. So for example, we used to, probably for like the first 2 years of the CHSE exams, we used to use item writers could also review. It wasn't 2 separate groups. And then we've changed that. We've noticed that sometimes during meetings, some of the subject matter experts would be struggling about an item. What does it mean? What is happening with it? And then the item writer would self-disclose that it was their item and go, oh, that's my item. And what I meant by it was blah, 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 blah. And then the group would go, oh, okay, perfect. I get it. Yes. All right. Accepted. Move on. Next item. And I go, no. We can't do that, right? Because the candidate doesn't have the benefit of you sitting behind them, during the test and go, this is my item and what I meant by it was, right? So also, the review process is sometimes really, really tough for an item writer to see. Everyone's items get completely revised and edited and almost torn to shreds. And it doesn't matter if it's your first year or your 10th year, it hurts a little to see that an item that you've spent so much effort on being completely transformed by the group. So we now have that firewall between the item writers and the item reviewers, and we've been using that as practice. So just an example of how we've grown since we started 10 years ago for CHSE. Again, new forms are constructed yearly. So this is a yearly process for the test development cycle. As long as the exam forms are tied to the same practice analysis, they can live on for the whole 5 years. They just get kind of knocked down a peg and are used for retakes. So someone who fails the exam and retakes it is not seeing the exact same collection of 115 items. They see a previous form. And the system, the candidate management system takes track of that and will assign forms based on one that the candidate has not seen. So if you're taking it for the first time, you always see the newest form, but if you fail and you come back, you see a new one, especially if it's within the same year. And just to kind of close this off, I wanted to share with you as of August 1st, what we have now for currently certified individuals. I believe as of August 1st, now CHSE is at 3,000 certified individuals. So that is huge news for us, 3,000 certified CHSEs. We have 102 CHSEAs, 672 CHSOS folks, 34 CHSOSAs in 43 countries. So this is absolute big news for us. We hope that if you have not yet taken your certification exam and you're interested in it, that you found this presentation a bit useful. Again, we do focus on, it's healthcare simulation as it applies across countries, as it applies across practices. This isn't a exam that's specific, neither the CHSOS or CHSE are specific to one particular area. We want to give as much love to our EMTs as we do our nurses. It's across the board, and our efforts in recruiting a whole bunch of SMEs to work on all the different types of processes and our continuing monitoring of the exam items really help to support that. So with that being said, I believe I am almost at 40 minutes, so I want to stop and ask if there are any questions. I wonder if I can see hands raised. I see there's a question in the chat. Any tips to prepare for the CHSE exam for novice sim educators? Oh, great question. So my recommendation of how to prepare for the exam is to go through the examination blueprint first and foremost. So the examination blueprint for the CHSE is in the CHSE handbook. So you can find it on the website in the CHSE handbook. And that goes everything. So it outlines everything that we can test on and everything we will test on and the level that we'll test it. So if you look at debriefing, right, is going to be on the outline, and it's going to have, an application critical level thinking verb to it. So you need to know that that means you need a working knowledge of debriefing. We're not going to ask the definition of it there. So if you're like, oh man, I really don't know about the theories of debriefing and when they apply, that's maybe why you want to focus your study efforts. Also look at the breakdown. So for example, the leadership category isn't as heavily weighted as the others. So there's gonna be less questions asked from those areas. So what I would do first, print out that content outline, go through it, highlight areas that you're just kind of not really strong in, focus your efforts there, and then take the practice test and see if the practice test reflects that. So the practice test does give you a breakdown of your strengths and weaknesses per the domains. And then it also, you can go back in and see what questions you got wrong, and there'll be a rationale of why the correct answer is the correct answer. So you can use that to kind of prepare as well. So I hope that that helped.
That really helps. Thank you.
No problem. So next question, touch briefly on the application and testing process. Okay. So the application, again, you do that through the website, through the candidate management system. Applications are pretty streamlined. It's going to ask you a bunch of different questions that you really respond yes or no to. Also in the application, you can request extra time if you need for an ADA requirement, or just if you have English as a second language, or any reason that you would want extra time, you can request it through there. But there are different sections, and it takes you through like next, and next. I don't want to talk too much about the application process here because that's not really my strong point. But if you want to email director@simcertification.com, I would be happy to set up a call with you and go through the process in a bit more detail. The testing process is different depending on the mode that you wish to test. So you could come to IMSH. This is our plug for IMSH. A registration is open if you want to come to IMSH. I highly encourage it. but you can take your exam there. We will have opportunities to take the test at our little testing center. It will be proctored. For that, you can also go to, when you register, go to a standard brick and mortar testing site to take your exam. And then there's also remote proctoring. So the only disadvantage of remote proctoring is that you really need to make sure you have a solid, strong, fast connection to the internet, because it does put a lot of stress, I think, on the computer. And then the proctor, yeah, just remotes in and watches you while you take your exam in any location of your choosing, as long as it's a quiet room with a closed door and all that good stuff. How can you request a larger font at the testing site? So your proctor should be able to help you with that. So our IQT testing partners has already something in place in the exam where you just go in and you can zoom your screen. So the font doesn't really change, but the screen will get bigger. If you go to iqttesting.com, they should have a demo exam on there, so you can go in and see kind of what a test will look like at their through their secure browsing window and through their test delivery site, and you can mess around with the zoom function and the other functionalities of the exam. Again, that's iqttesting.com. There is a demo. I believe if you select like 4 candidates, and then there should be a demo in there. And then if you are playing around with that zoom function and it's not working well enough, you can email, again, director@simcertification.com, and then I will get you in touch with the ADA representative at IQT Testing to make sure that you have exactly what you need for your examination. Any other questions? All right. Well, then I am going to give you all back a lot of time of your day. So thank you so much for joining me. I hope this was helpful to see an insight about how the exams are developed and how the items are constructed and monitored. And for those of you who are already certified, I really hope that I talked it up enough that you're going to want to volunteer and become one of our subject matter experts and either write test questions or approve an exam form or review statistics with us. It's always a lot of fun, and we couldn't do anything without our subject matter experts. They are absolutely imperative to creating a fair, valid, and reliable certification program. So without them, we wouldn't hit those check marks, and I know that's extremely valuable to me and everyone involved in SSH certification. So again, thank you, and I hope you have a fantastic rest of your week. And till we meet at SSH or SSH. Oh my gosh, IMSH. Bye, everyone.